What is the risk of a child becoming sick with COVID-19?
Well, I think, that everybody's at risk of, getting COVID. Now, the whole population is at risk, and the risk doesn't change because you're a child or you're an adult. So, the risk per se is there for everyone. And we all have to take the same measures so that we don't get it. Um, then from children to adults and the elderly. So the risk is, there's not children don't have a different risk than the adults. Is that we adults are the one who travel. If most people who are traveling in these areas are more and coming back here are adults. Um, we kids are still in school, and we're not in the vacation period, so most people haven't gone away. So children are not coming in sick, but everybody carries the same risk.
Understood. And with those risks, what are the symptoms of COVID-19? Because I understand that they're different from adults.
With the same symptoms as cough, yeah, the kind of dry cough, the rhinorrhea, the fever. Those three main things, like any kind of viral infection. It's just that most kids, so far, kids have had relatively mild symptoms. And the mild symptoms are just the same thing, cough, rhinorrhea, and fever, but not progressing to any kind of serious illness. Pulmonary changes are happening, but not as serious as adults. So kids are getting less sick. Infants below 1 are higher risk, same as the elderly, but the progress with the disease in children so far hasn't been that critically ill, moving from that period of just the milder to moderate symptoms to the critically ill. There have been a few kids who've been critically ill, but those are kids who have underlying medical conditions, immunodeficiencies, and other chronic conditions. And so, we are all at risk. Although most healthy children will have milder symptoms than the adults, they progress less into the critical zone. Um, Whereas adults and the elderly are getting more into critical areas, especially above the age of 60. And young adults with comorbidities are getting worse symptoms.
Dr. Nawab, before we move forward, can you just give us a little background about the coronavirus so everyone is able to understand how this got started and what to expect from it?
Well, I'm sure everybody's familiar now with everything that's going on in the history of the coronavirus, starting from this novel coronavirus, starting its epicenter of it being in Wuhan, China. And the coronaviruses exist, but this is a new coronavirus which moved from the research from an animal pathogen, an animal carrier into human carriers. And so we've seen the progression of the disease worldwide. And, it's one of those where, like any other viruses, and almost with the same kind of transmission as the flu virus, but with a faster outcome than the flu virus. So far, when you look at the numbers of the death related to flus over the year, the period of this year alone, the deaths are higher in flu than the coronavirus. But the intensity of the coronavirus is what worries people, because it's definitely, the progression of disease from the moment you get it to ending up, in an intensive care unit with really severe pulmonary disease is what is worrying. And so the spread, we can just seen from being the later part of last year in China to now progressing almost worldwide to over 190 countries in the last WHO report. So we're seeing, when we're following it worldwide, we now have 164 countries with 194,000 plus confirmed cases, and almost close to 8,000 deaths, and it's global. And so the speed of spread, I think, is what is worrying, in the intensity of the the movement from just a mild disease into a critical situation is what worries, not the overall deaths per se.
Thank you. Also, I know there's a lot of misinformation about the coronavirus affecting seniors more, and we have heard cases of children, some of them being affected, but not necessarily the symptoms aren't the same, or the virus itself doesn't affect them the same. Can you explain why this is so, or if this is actually the case where children can't really get affected?
Children can get affected. There's not, it's not that children don't get affected. They do. They catch the virus. Now, there's still no real explanation to why children seem to have a milder case. And it just probably has to do with a kid's immune system. Now, there's still studies going on now to see what makes it that children don't develop severe cases. And in certain children who have developed severe cases, even with pneumonias and stuff, they've realized that children have a higher rate of getting superimposed bacterial infections after they've had the COVID-19 virus. So they're not they get a milder form of the COVID, but getting superimposed bacterial infections. So it has to do with the immune system, and they're still trying to elucidate why children seem to be a little bit more resilient than the older population. Now, that also has to, the logical thing is that the immune system in an older person, and the same thing with newborns, at the extreme ends of age, your immune system is not as strong. And so part of that is just the evolution of the immune system as such as it is. And maybe that's what's given that kind of protective nature um, of a younger child having a better immune system than somebody who's, in the elderly age group. And also, if you have other comorbid conditions, you know, you you're more easier or you're much easier to have complications arising from your chronic conditions due to the impact of this virus.
Dr. Nawab, we are receiving a few questions that I think we should answer.
Okay.
Someone stated that their daughter has asthma,
Yeah.
and she just wants to know, with the changing climate and her asthma being is she at risk or considered at high risk for her asthma condition?
I don't think because you have asthma, you have a higher risk of catching the COVID. Everybody has the same risk of catching the COVID. This is probably for the asthmatic, because if you have an underlying medical condition, pulmonary condition, you might be worse. And so, unfortunately, we're in the era, in the time where also asthma patients are getting a lot of issues with their asthma because of the weather changes. And so we advise all asthmatics to get on their preventive medication, make sure they wash their hands, take the necessary precautions, don't try to avoid catching any colds, make sure they have all their flu vaccines. I mean, we started, advocating for flu vaccines earlier last year to try and get them at least protected. Uh, and so asthma doesn't make you more predisposed to get COVID, but with somebody with asthma, with any kind of pulmonary condition, has a higher risk of getting more complications because of the underlying medical condition. So the risk of catching is not because you have an underlying condition, but the risk of progression from a milder symptom to a probably moderate symptom and probably to critically ill would depend on the underlying condition that you have. Am I clear?
Yes, yes.
Mhm.
Also, there's another question about someone's parents having underlying conditions with dialysis and chronic heart failure.
Mhm.
They want to know, should they keep their daughter away from the grandparents, or would the 14-day self quarantine be effective?
Well, I mean, if the child has traveled or the child has been in contact with somebody who's traveled, I mean, you know, the Bermuda, the Department of Health, and has put out guidelines regarding this. And I think one of the things is that we still have to keep on maintaining our hand washing techniques and trying to make sure if the kid is sick or has a runny nose, I mean, definitely has to stay away from the grandparents, because if we don't want anybody who's sick around anybody who's on dialysis or who's got a chronic medical condition anyway, in general, whether there was COVID-19 or not. And now with this, the risk is higher for more complications. So the same way we lead our daily lives of making sure that we clean our, we wipe down the surfaces, we wash our, keep proper hand washing techniques, and keeping away sick people from people who have medically challenging conditions or underlying medical conditions that are chronic conditions. I think we just need to amp up what we're doing and do it a little bit more frequently, and be careful with the people that are most vulnerable in taking good care of the people who are more vulnerable, the most vulnerable people in our society. So, in this case, if the little kid has been in contact with somebody who's sick, or the little kid is sick, I would say, well, then don't keep them away from the grandparents, until they're better.
Exactly. So we have someone here that has tuned in here in the office, and she has a question that she would like to ask you.
Hi, Dr. Nawab. Thanks for your time today. My question is, would you be able to let us know what the protocol is for a parent who notices that their children is starting to exhibit flu-like symptoms? I know that generally speaking, we don't want to just bring our kids to the doctor anymore for our first for the first interaction because of the the situation that we're under. So would you be able to just advise what a parent should do if they notice their child is exhibiting flu-like symptoms, so that we'll know what to do?
I think the biggest thing is also that we're in the flu season, and we're in the winter where a lot of colds and common respiratory illnesses are around, viruses. So my advice is, if your child has a runny nose or fever, and there's no travel history, um, in the relative, no kind of close contact with anybody who's got a travel history, or the child herself doesn't have a travel history of having been out of the country or coming from an area where there's been a high list of patients with COVID, is to just monitor the child at home and see how the child, how the evolution of the disease in the next 48 to 72 hours. Now, you can manage a kid who has a fever like that, um, with Tylenol, and make sure that they're having their usual fluids and keeping them away from school and watching them. You can call the best thing is to call your GP and let them have a conversation with them. Now, what we are advising people to do is that they call their GP, have a telephone conversation, and elucidate how these symptoms have started, trying to get that history, if there's any kind of travel history. If the GP thinks that your child needs to be further seen or swabbed, either by their office or by the Department of Health, and there is travel history and the possibility that they might be in contact with COVID, there's a WHO form that they have to fill. Now, they can fax that. They have to fax that to the Department of Health. Department of Health will send that to CARFA in Trinidad to get validation to see if the patient is really a candidate for testing or not. That takes a couple of hours. You get a feedback. If there's a suspicion of COVID, the Department of Health will get in touch with the family or with a GP and say, well, if the GP has already swabbed you, then they will go collect the swab. If not, they will get in touch with the family and get a family to go to the Department of Health and get swabbed. Now, these are cases that the GPs and the pediatricians, we have to do the triage and make sure that it just is not just an ordinary cold or just flu symptoms and not COVID-19. So it's something we can't just be rushing to the doctor's office just we have a child has a cold or a runny nose and a cough. I think we want to protect the frontline providers, nurses, doctors, GPs, pediatricians, ER physicians. And so be insisting on people calling ahead and discussing these symptoms with their primary care physician, making sure that they can triage and say, well, if you need to come or not, and give you, the wait or come back, the following day, wait till the symptoms change, make sure things are really not aligned with COVID or the or any other kind of disease.
Perfect. Thank you so much.
Thank you, Dr. Nawab. We have
You're welcome.
another question that came in. A concerned parent with a 2-year-old son is currently using the preventer. He has a regular non-COVID cough, more like a bronchiolitis, and she says he's fine, eating well, and playing happily. Should she keep him home from nursery?
The bronchiolitis is also caused by different viruses. So we have, non-RSV and RSV bronchiolitis. Now, if the kid is happy, eating well, it's a conversation that they have to have with the nursery. I mean, if it's not having a runny nose, and it's not at risk of spreading, especially if RSV, which can spread easily. If he's gonna depend on the size of the nursery, depend on how he's being cared for. If he's in his own little small place, a 2-year-old, no runny nose, not much cough, they can go back to the nursery. Now, if they're coughing and having a runny nose, then the risk of transmission of this RSV most likely is, which is the most common bronchiolitis that we get, would be higher. So our advice, keep them home until they get better before you can get them to the nursery, because you don't want anybody else to get sick. Now, unfortunately, I'm saying within the winter season where we get a lot of respiratory viruses too, we can test for those viruses. There's respiratory virus panels that you can do to see whether there's RSV or kind of other viruses that we have. So if it's getting worse, they can call and then they can be tested too. But if they're getting better on the medications and they are not at risk of transmitting what they have, then they can go back to the nursery. But if there's a compound of compounding disease or compounding symptoms of fever, excessive cough, child looking unwell, then they need to be seen. And that's when you probably have to call and say, okay, we'll see the child. And the GP will find ways to either bring them in. Certain offices are seeing patients in the waiting in the car park, trying to avoid a lot of people coming in their waiting rooms. So anybody that has to be seen in discussion with their GP or their pediatrician or their primary care physician has to arrange for that to happen if the kid's symptoms are getting worse.
Okay, Dr. Nawab, what about the use of masks? Is it really necessary to wear them at all, parents or the children?
Well, the use of masks generally is not recommended unless you are coughing. That's when because if you're coughing, then you have to wear a mask. But if you are not coughing and you're not sick, the use of a mask is not really going to help, because you're going to be touching your face, trying to adjust your mask, and that's a higher risk of you catching something because your hands are always will be in your face, and you're not supposed to be touching your face. After you've washed your hands, and trying to avoid touching other things. And so, use of mask as a normal kind of part of our normal lifestyle is not really recommended unless you're coughing and then you want to stay away from people, and you can, you want to avoid spreading droplets. That will protect the others around you, but it won't protect you from catching something, if you're not coughing.
And what happens if a child does test positive for coronavirus? What are the parents' next steps?
Well, the guidelines that we're using, which the Bermuda government, guidelines, is to try and isolate the whole family and observe the child. Now, there's no cure for coronavirus. So, you just have to basically symptomatic management of the child, reducing the fever, make sure the child is getting a lot of fluids, and trying to contain the virus within that nucleus. So if the child is, was sick and had a history and it was tested positive, I mean, fortunately, we don't have any case, positive now in Bermuda, But in case we get one, the whole family has to be isolated. And then that contact, the epidemiological contact evaluation has to happen to try and see who's been in touch with the child, who can we, and then we start isolating and trying to isolate the virus. You would do that for any other sick child, and then especially with this, which has a higher, where we're dealing with a very, very kind of critical, critically ill, the spread and the evolution of this virus in elderly and the immunosuppressed causes a lot more critical issues. We need to be more conscious of the fact of self-quarantining, isolating, and doing the basic, trying to protect others. If children, if a child tests positive, we just have to do the same measures that we do with everyone else who tests positive, whether it is a child or an adult. Is to just isolate the nucleus of people surrounding that person and start doing the epidemiological research and trying to get everybody who's been in contact with those that child or whoever the person is, and try to isolate the virus as much as possible.
What advice regarding the use of NSAIDs after the French government reports that ibuprofen could cause problems in those with coronavirus?
I don't think, I think that's something that's going around, but we really don't know. I haven't received any kind of official report on that. The WHO hasn't posted anything on that, nor the CDC. So we have to be very careful with things that are being sent around. Sometimes, you get all this, there's a lot of rumors and things being sent around, and we have to be careful that, we look at the official websites and get the official information. So the CDC and the WHO website have, a website that I think people should just look at for all these updates. You can get all the updates there and try to avoid any kind of WhatsApp kind of messages that are being sent around, because a lot of these are just people, you don't know what is a real thing. And so I would be careful, sending out and all these messages if you're not looking at a real, true websites that are trustworthy. The CDC, the WHO are feeding information on a daily basis. And so that would be my go-to if I have any concern. But I haven't had any official report about the use of NSAIDs and coronavirus.
And what are the best ways to boost your immune system naturally?
I always come back to people and I say, if there's something natural to boost your immune system, we'll all be super immune. There's nothing to boost your immune system. You keep your immune system healthy, one, by eating well, not smoking, not drinking excessively, taking care of yourself as a human being and being healthy. And if there was a super supplement to boost our immune system, the whole world would be better. I wish there was, and we get people like that who don't want to get vaccinated against the flu, or who don't want to get vaccination because they feel that there's a natural supplement that will make them invincible against any disease. It doesn't work that way. You're born with an immune system. You have an innate immune system, and over the years, as you acquire infections, you develop your immune system. You get vaccinations to protect you, to help you fight infections that can kill you, that can, cause disease. Currently now, there is studies now people are working hard to get the virus for COVID-19. So we always working hard to do things to try and look for vaccines and look for ways to make our body healthy. And part of it is the whole concept of taking care of ourselves, making sure we eat well, making sure that we don't do damage to ourselves by excessive detrimental lifestyle. But if there was something that you could take naturally, I'm sure, that would be the number one bestseller on the vitamin list. So people say, well, I want something natural. There's not a magic pill. You have as a whole have to have a healthy lifestyle. And there are things that will make you weak. If you are excessively drinking, yes, you depress your immune system. If you're a chronic smoker, you depress your immune system. If you're obese, you depress your immune system because you're not eating well, and all that stuff. And if you underline, so, but we can't be. There's nothing really. There's not one thing that can boost your immune system. There's not one thing that will kill COVID. People are saying eat garlic. There's no study showing that garlic is going to make you fight COVID-19 or any other viruses. So there are the understanding of what our immune system is that we need to know that we have to live healthy to keep it working well. We already have it. We have a good immune system. And unfortunately, some people don't, are born with immunodeficiencies, but they're the minority. And then we have to keep our immune system well to protect these people from getting, catching diseases. So we have an obligation. The elderly, have a weakened immune system. We have an obligation as people who have a stronger immune system or healthy immune system to keep ourselves healthy, keep the community healthy, and then by extension, everybody who has a slightly weaker immune system than us get protected, and that's herd immunity. But there's no one natural thing that you can take to just boost it and turn it into a super, and turn your immune system to some super immune system that will fight everything.
So right now there's a lot of self-isolation happening around the world, and I know some schools are currently closing. So how can families cope with self-isolating together?
Well, it's a stressful moment. I mean, to be self-isolating, but these are critical times, and so we all have to be disciplined in a way. We have to find things to do to make it fun. We have to, make it less stressful. And part of it is, there are um, guidelines and there are, you know, contacts, through the Department of Health, through the various organizations that people can call in. You can, call in and, get food delivered, or you can get in your, do your shopping online now. There are resources out in the community through the Department of Health and, through the various GPs that you can access and find help if there's any kind of stressful moment that you're going through. Definitely people are going to be under stress and depressed, but, that's why our psychologists, the community psychologists are also offering their help. And so the whole community is banding together. We're not self-isolating and then shutting people down. There is communication. These people need help. The more we self-isolate, they will need, the families and all of us to offer our services either online or through encouragement, trying to help as much as we can. Doing, if you have a neighbor who has traveled and lives alone and is self-isolating, share your food with them. Drop it at their door. Call them and say, look, I have toilet paper for you. I have food for you. You're self-isolating for the quarantining for the last 14 days. You have somebody to help. So we have to come together as a community to be able to hold this virus down and flatten the curve. And part of it is going back to live as a community where we share our resources. We help our neighbors. I mean, if you have a neighbor, you have somebody an elderly couple who, maybe cannot go out because of all the restrictions, offer your help, lend a hand. Be a good neighbor, be a good person, be a good community member. I think that's what we have to do. And people need to self-isolate because they have to have the understanding that they could be a risk to the rest of the community. So we have to create that internal consciousness and say, look, I'm not the only person. I'm not the center of the world. I'm not the center. We have to protect ourselves, and there's a self-preservation, but that self-preservation also comes in part of that community preservation. So, I am my own keeper, but my brother's keeper, yes. So we have to take that into really a good context of how our moral obligations and our societal obligations and our brotherly love has to fashion in these times of crisis. Unfortunately, we haven't reached there as yet, but we may. And so we need to start thinking ahead and saying, well, how do I find out who is near me that will need help? And how can I help? Some people have, some people don't. How do I offer that help? And I think we need to look for those resources, and some of those resources are available through, through our community, our churches, our pastors, our community resources that we have, the department, the Pyramid Health Council, and play a role. So we all should gather those resources to be able to keep that virus at bay without stressing and ostracizing people, and making sure that we all live, without having to say, well, this person came in and got a virus, so let's isolate them and not doing anything to them and not reach out. But I think as a community, we can do a lot more. If we think that we can, if we want to beat this virus, we have to be a united community, a united front for this.
Dr. Nawab, is it within your scope to speak on COVID-19 and pregnant women?
So far, I mean, I think the best person to speak to these are the obstetricians, but we have guidelines that we received, and there hasn't been a higher risk in pregnant women than the average risk that everybody carries. There's no vertical transmission so far. They haven't seen any way of COVID-19 passing from pregnant women to their children, which is good news. And the pregnant children are not getting as sick as the elderly. So there's a good news about it. So they are not having any kind of critical issues or critical healthy pregnant women who have had COVID-19 have mild to moderate symptoms without any complications. So there's a good news in there.
Also, is it true that a person who does not present cold-like symptoms could pass the virus on?
There is a small percentage, and you still don't know how that's happening, but you have 2 to 10 days if you get in touch with the virus to express symptoms. And so, within the first 2 days that you have, some people who are not even having the classical symptoms of the cough and aerosolizing the virus is still not known completely. And it's probably maybe, close contact, sharing things that could pass the virus. And so, the key lesson is that, keep out social distance, try not to get too many people together and go stop all these events and go to parties, and try to limit our involvement with a larger group of people in places, wash our hands frequently, because we really still don't know much. The main source of transmission is through droplets. And there's a small percentage which are passing in asymptomatic patients, transmitting from asymptomatic patients. But those are the very few. And so it's still under investigation. It's an ongoing, this new coronavirus issue is still an ongoing fluid situation. We're still learning more as the days go by. So, I might say this is, we don't know the real percentages of asymptomatic transmission now, but then maybe in the next week we'll understand more about it. But so far, it's a very small percentage, and they're still trying to elucidate how that's happening.
Also, what precautions should parents take when they travel?
Well, I think avoiding any kind of traveling around this time, any kind of traveling should be avoided unless it's really essential. And, trying not to wipe down all kind of hard surfaces, especially in planes, making sure that, you wash your hands as much as you can, not touching your face, after you've touched any surface, any unclean surface. And self-isolating, because if you pick up something on your travels, but I will advise people. I mean, a lot of people have canceled their flights, their travel plans for the next month or two. I've had to cancel 2 travel plans. Are they essential? Not really. I mean, my health is more essential. The safety of my population is more essential to my travel plans. So I prefer not to travel if I have to stay and keep Bermuda healthy. my plans don't matter. So I think we should all make that concrete effort to say, well, let's hold up our plans. Let's not travel. Let's not go to this, because the numbers are increasing everywhere. And the US's numbers are increasing, the UK numbers are increasing. So until things die down a bit, I will advise against, any kind of non-essential traveling, unless it's an extreme emergency where you have to, travel.
Correct. Also with parents, getting, a little anxious, or families getting anxious about this time, what advice should parents give when kids are coming home talking about the coronavirus?
I think just insist on the whole, try to be calm about it. We can't get into a panic. Consistently teach our kids, what the virus does, telling them that this is a virus, and if you don't wash your hands frequently, if you don't use a hand sanitizer, if you cover your cough, if you cough and you're feeling unwell, let me know. Teaching the kids how to do things that we normally have to do anyway, and just ranking it up, pulling up a little bit much more, and keeping an eye on the children and making sure the children are healthy and they're eating well, making sure getting them to understand how being healthy helps, trying to keep healthy habits help, and eat healthy eating, washing their hands, same things that we do. But I don't think trying to panic and to be. I mean, there's an anxiety, but we have to keep calm during all this anxiety to be able to function. Because anxiety doesn't make us think, and you get anxious, you panic. So I hope we can just explain things to our children, let them know that they have to make sure they wash their hands, keep their coughs covered, and let you know if they're feeling unwell, and making sure that they're eating and keeping themselves healthy all the time.
Perfect. If there aren't any other questions at this time, I would like to thank Dr. Nawab for dedicating his time to inform us. Um, Hold on one moment. I think we do have another question that just came in.
Yeah.
Someone asked, about protecting their immune system. I know you mentioned it before, having proper rest and healthy diet, washing your hands. Are there any other advice or recommendations to ensuring that we can stay healthy during this time?
I mean, there's nothing much more than you can do. I mean, there's no amount of extra vitamins or any amount of juices or any amount of things that you could take. And so I always tell people, just make sure that you keep yourself healthy. If you have a free chance to go and do a little exercise in the open air, just do it. You know, if you're on medications, just take your medications. If you're hypertensive, make sure your blood pressure is fine. You're asthmatic, take your preventer, which is very, very important. You know, make sure your bronchodilator, your Ventolin, you've got your stock of medications. Make sure you have everything planned. Drink lots of water. Avoid people who are sick or coughing in your face. Avoid getting into crowds. Wash your hand as frequently as you can. Have a little hand sanitizer in your pocket where you don't have access to soap. Use your hand sanitizer if you can. You know, try to minimize your risks. But in a healthy body, your risk is low. If you have any kind of chronic condition, get in touch with your GP. Discuss your current state of health with your GP or your primary care physician. Have a conversation with them. Create an emergency plan with them. Say, okay, when can I call you? When do I need to call you? And have that discussion. I mean, most offices are now offering a lot of phone conversations to their patients. So, it's we don't want to all overwhelm the system. But if you have a chronic condition, make sure you program in all your medications, have everything in from call the pharmacy, make sure you have a stock of medication so you don't have to be rushing to the pharmacy to go pick up your medication every 2 weeks. And so we have, it's a little bit of, takes a little bit of planning. It's critical times. As I said, we don't have any cases as yet in Bermuda. We could have, maybe, we don't know, one or two cases, it could go higher, but we have to start preparing for that. But in a calm manner, without getting too anxious, because you see people just going into the stores and trying to stock up on everything, and rushing to get everything. We have to keep calm and try to say, well, prepare diligently, but not with panic and anxiety.
Does the virus actually cause permanent damage to the lungs, or is it similar to cold and flu-like symptoms?
So far, those who have recovered, there are some who are having some damage to their lungs. So they've seen some organ damages in some cases. But as I said, this novel virus is still in its stages where things are, the studies are still coming out. So we might not see, it's been less than a year. And so studies are going on, studies are showing up. So we still don't have a lot of information on the long-lasting effects of this. Hopefully, it's not a virus that will cause any long-lasting effects in the people who recover from being having critical pulmonary issues. I don't know much about what's happening now with that because it's still ongoing and there's no studies as yet. But they're still gathering information. We're still looking at patients who've recovered in China and other places to see. And as the process goes, we will know more about the virus and its effects with time.
And I know that you stated this earlier, that we aren't aware of, we don't have enough information about the coronavirus, but someone did ask, can you catch the virus after you have caught it once?
We don't know. And I don't think so, because most of these viruses will give you an immunity, but we still don't know much about it. So we're still waiting to find out more.
Thank you. I have Dr. Ricky, the Health Council CEO here. I believe he has something that he would like to ask.
Yeah. Hi, Ricky.
Dr. Nawab, thank you so much for providing information. We've been receiving a lot of different questions from kind of different cohorts of people. And what we wanted to do was to address these kind of questions in segments. So for example, today was around children. There's been some questions around for diabetics or individuals with kind of long-standing chronic disease. How do we manage those in the face of COVID-19? So on Friday, we will have an endocrinologist who will provide a similar opportunity to answer questions. We realize that a lot of the answers to some of the questions are not known yet because this is a novel virus.
And it's ongoing, yeah.
And we're still learning things day by day. And I would ask that everyone give some patience to those who are working around the clock on some of this, as the strategies have to evolve as we learn more day to day. But we promise you, from the Health Council standpoint, we will try to provide as much up-to-date information and access to people who can give you the answers that people need. If you have any questions on anything regarding what are the strategies that are taking place, what are the efforts, what are some healthcare professionals that you can talk to, feel free to give us a call at 292-6420. That's 292-6420, or send us an email at healthcouncil@bhec.bm. Understanding this is an uncertain time for a lot of people, for all of us, and we're, as Dr. Nawab would have mentioned, we're all in this together, and in some ways we have to be each other's keepers. So with that, I'd like thank everyone for joining today. And on Friday, at what time?
Friday at 1:30 p.m.
Friday at 1:30 p.m. we'll have Dr. Annabelle Fountain to discuss from an endocrinology standpoint what are some specific things that can be done to maintain wellness and to prevent any spread of disease with those kind of underlying conditions. Thank you, everyone, and have a good Wednesday. a safe one. Thank you.